Hi, this is Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. And this is part 2 of cervical insufficiency or incompetent cervix. And in our last video, we talked a little bit about what an incompetent cervix looks like and a couple of the indications for it, which can be a traumatic birth, which damaged some of the cells, biopsy for an abnormal pap smear, or conization that's often done in the treatment of cervical warts or genital warts. I shouldn't say just cervical, but genital warts, but have attacked the cervix. One of the other things I didn't address then, because I really wanted to bring it over now into this talk, is inflammation of the cervix. And we're really just scraping the surface of this. Kathleen Kendall Tackett and a lot of researchers who do psychoneuroimmunology have been looking at this and noting that maternal stress causes moms to release a lot of neurochemicals called cytokines, which they have found act on the cervix and cause it to ripen in preparation for childbirth. Now, when it's after 37 weeks, this is great because it's time for the baby to come. But before then, a release of cytokines that can cause preterm labor, all the contractions and the dilation and the ripening of the cervix, it's not a good thing. It's too early. But they have seen that these cytokines are released. They know it's related to stress, has something to do with kind of that fight or flight mechanism, but still a lot of the details are yet to be elucidated. But one of the other things that they have found is that progesterone can help this. And it's like, well, how can that happen? We often use steroids, and not necessarily the sex steroids, of which progesterone is one, to ward off inflammation. I mean, if you have a bad allergic reaction, for example, people are often given prednisone or prednisolone or some other steroids. We give cortisone when we're trying to mature the baby's lungs. There are just lots of different reasons and indications when we use steroids, but a lot of times it's to reduce inflammation. And while progesterone isn't necessarily one of the mineral corticoids, glucocorticoids that are used, it may have some of that effect. We don't know, but we do know that it works. And progesterone, it's either given in a gel form, can sometimes be a vaginal suppository, or it's given as an intramuscular shot. And what it does is it helps keep the uterus from contracting a lot, which is the first thing. And this is when we're talking second trimester, because when it's used in first trimester, it has a different indication, and I can go over that in just a second. But it helps uterus keep contracting, but it also seems to help the cervix from ripening, from shortening, from opening, dilating, retracting, becoming effaced, as it were. And again, we don't want to see that before 37 weeks of pregnancy. We want that baby to stay in for as long as possible. We want the baby to have all the time possible in the uterus, getting fed from the placenta, getting all that nurturing and nourishment from mom, because it's the best place for the baby. But, sometimes things happen. But we have found that progesterone in the forms of the shots or in the progesterone gel can be effective. So what could actually be the mechanism? As we said, if the uterus is contracting, having preterm labor, the progesterone can go in, and it seems to keep that from happening. Now, again, the mechanism, I am not exactly sure. Also, it seems to stop this shortening that goes on and effacing. So when the sides thin out and, in preparation for preterm birth or preparation for birth, just depending on the time. And so, yeah, progesterone's a really good thing. But one of the things I want to address as well that we know Bedrest helps a little bit with, but we're still not really good at advising about is reducing maternal stress. Now, part of the reason sometimes the inflammation happens, as I've said, is because of the cytokine release. The cytokine release happens as a result of the fight or flight mechanism, which is a stress reaction. Now, a lot of women say, but I'm not stressed, I'm not upset. Stress takes many forms. If you're worried, if you're rushed, if you're hurried, if you're um, moving about a lot in kind of a hurried fashion, you may not, that may be your norm. You may not perceive that as being stressed, but your body is perceiving that as being stressed, and it's reacting in that way, putting out those cytokines, which are finding their way to your cervix, and then, ripening it. Now, then there'll be people saying, well, you're saying it's the mom's fault, and, it's all because of her stress that she's having these contractions and everything else. I'm not saying that, but I'm saying it's one mechanism, and it's one thing that can be addressed. We address it with the progesterone. We also need to address it with stress reduction, anxiety reduction, and making sure mom has her needs met. A lot of women say, I'm really stressed. I have older children that I'm worried about, whether it be a toddler or school-age children that when they're on bed rest they can't take care of, or they have other obligations that they're concerned about. The concern can then translate as worry in the body. It's in the body, how the body is perceiving it. And I have been kind of talking with a lot of women, and I just don't feel that we clinicians adequately address women's concerns and their worries about maybe going on bed rest, having a baby, the family stress, family structures. And again, in concert with progesterone, in concert with bed rest, whether you need a cerclage or not, whether you use a pessary or not, if we are not addressing a woman's stress and anxiety, we are doing her a disservice, because as far as I'm concerned, we have not fully treated her. Because the thing is, we can give her all these treatments if we're not kind of halting the offending agent, if you will, which is stress, then we're chasing the 8-ball. So I want to toss that out there, ladies. If you are concerned about how you're going to make ends meet, who's going to pick your child up from the school bus, what's going to happen with your job, there are a myriad of things that are going on that can be running through your head. Please address them with your obstetrician. Address them with a friend. If you need to see a therapist, see a therapist. You can do this on phone and online now. But do manage your stress. There are some great meditation tapes out there. A lot of people are doing hypnobirthing, hypnotherapy. But address your stress, because that constant pulsatile release of neurochemicals may be, I am not saying it absolutely is, but may be exacerbating what's going on with your cervix. It may not be the cause, but it may not be helping. So keep that in mind. Yes, do the progesterone, but remember, a lot of this, a new finding is that this is in part due to inflammation, and that is in part due to the stress reaction. Do what you can to reduce your stress. No blame, no shame, just a suggestion. So yes, I'm going to take my modeling clay now and be done. And this will conclude our week of looking at what the incompetent cervix is, how it's treated, what brings it on, and what possibly may help it, and what you as mom can do. Get rest, stay reclined in bed, get that pressure off the cervix, and most importantly, reduce your stress. Follow your doctor's instructions. Take your progesterone if you are on it. Make sure the pessary and everything is fitting well, that you're comfortable, because if it's not fit properly, it will be uncomfortable, and that's no good. But, speak up. Talk to your providers. Let them know what is working, what isn't working, what's comfortable, what isn't comfortable, so that they can help you. Again, it's all about being pro-action. Be pro-action on your own behalf and on behalf of your baby. So that's it for me, Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond. Have a great day.